Today I will present the main features of the project, Mental Health and Well-being in Adolescence, exploring the role of social media. And I will also include some of the research results from the project so far. It's still an ongoing project. I'll start with the main goal of the entire project, and that is to develop a school-based intervention program aiming at a more health-promoting environment on social media among adolescents. And the background, it's already been mentioned, but the project is related to the rapid increase and widespread use of social media, especially among young people and adolescents, and also the concurrent worry about the potential negative effects of social media use on adolescents' mental health. And yeah, this worry can be seen, of course, in the traditional media outlets, but also present in the research community. And this has led also to a high research output, which has investigated the different things regarding social media, but especially use of social media and outcomes such as anxiety, depression, and well-being. And so far, the evidence is kind of weak, which has already been mentioned. Based on systematic reviews and umbrella reviews, there's little evidence of a strong effect of social media use, either on mental health or on well-being. But there's one important aspect which need to be considered, is that most previous research which is included in these systematic reviews and other summaries of data, have only focused on the amount of frequency of social media use. And we think it's important because they then neglect other potentially important aspects of social media use, such as motivations, experiences, activities on social media, and there's also been a limited focus on individual and contextual factors. So I think, yeah, future research and also our project have a stronger focus on these aspects. And in order to reach the main goal of developing an intervention, several objectives along the way were formulated by the project group. Some of them included increased knowledge about important aspects of social media use, and to identify both positive and negative aspects of the social media use. But importantly, we also wanted to gain insights into how these different aspects may be related to adolescents' mental health and well-being. And the target group was, for the first part of the project, was 16 to 19 years old people. And in order to develop the measures or the intervention, we needed to create a multi-stage plan to make sure that the development was scientifically sound and evidence-based. And this included, the approach included summaries of existing knowledge, qualitative and quantitative approaches, which I will get back to in more detail later on in my presentation. But first, I want to briefly present the project organization, as this project is based on a collaboration between several institutions and several collaborating partners. The project is a combined innovation and research project, which started in 2019 and has a planned ending in 2025. The Norwegian Institute of Public Health, Bergen Municipality, Vestland County, and Western Norway University of Applied Sciences are project partners in the project. And we also have an ongoing collaboration with researchers from University of Ottawa and Aarhus University. And we also have several grants, and we are grateful for grants received from the Norwegian Research Council, the Norwegian Directorate of Health, and Foundation DAM, among others. As this is a quite huge project which involves both innovation and research, we needed a joint effort from several partners. And I've already mentioned the scientific partners or the more institutional partners, but I believe the key factor for making this project possible is our approach to user involvement. And from the start of the project, we established a resource group of adolescents which have been involved in all activities related to the project. And in addition to the research group, we also have 2 upper secondary schools which were recruited as project schools, with involvement both from teachers, pupils, and school administration through the project. And in addition to the user involvement, the different parts of the project have also made good use of shared data resources, ranging from curated summaries of previous literature to results from the survey data. So we all, like the main partners in this project, have also had shared data resources. And I just want to mention some of the specific contributions from the research group, and because the adolescents' perspectives on and experiences with their use of social media is at the core of this project. And the research group, which you can see a picture of here, has been essential in all main activities of the project, from deciding on key topics to input on research questions and interpretation of findings. And this also includes specific input on the content and phrasing of interview guides and survey questionnaires, as well as giving the input on the collected data. And they have also, of course, been crucial in relation to the development of the main aim, the intervention. And the project schools have also made a contribution throughout the project by giving feedback and perspectives on our findings and by being involved in the development of the intervention. Also, the project schools have been available as an arena for focus group interviews, piloting of surveys, and testing different stages of the interventions as we develop the intervention. So I just want to get back to our approach. We started with several reviews of the existing knowledge on the field of social media use and mental health and well-being among adolescents, and two of them are published in peer-reviewed journals. And this approach, or this start of the project, made us aware of the available knowledge, the knowledge gaps, and this guided our next steps in the project. And based on the reviews, we were able to develop a set of research questions which we wanted to ask adolescents about in focus group interviews. The topics covered were all related to how adolescents think about social media use and their relationship between such use and their lives, including mental health and well-being. We also interviewed school personnel to get their perspective on the same topics. And I just want to briefly cover some of the results from the focus group interviews, which with the adolescents here, and both the results from the focus group interviews with the adolescents and the school personnel is already published, so it's available online if you want to know more about the details. We identified 3 main teams, each with several sub-teams describing different motivations, experiences, and perceived consequences of social media use. The topics covered in the sub-teams ranged from how people behave on social media differently to face-to-face interactions, and also covered upward social comparison and self-presentation on social media. But one thing that was clear from the interviews was that the adolescents viewed social media as an important social arena for them, which hold both the potential for which holds also the potential for positive and negative experiences. The focus group interviews gave us new insights into the thinking and experiences adolescents have in relation to social media. And by analyzing the interviews, around 100 new questions about the important aspects of social media were developed and used in 2 surveys of adolescents. This covered everything from specific activities on social media to experiences on social media and motivations related to the use of social media, as well as perspectives of how and why they use social media. And we have started to publish on some of the data from the surveys, and I will now present some of the first findings from these surveys. But however, as time is limited, I don't have the time to cover all of the specifics, but the publications are available online. And some in general findings from the project. In general, the notion from the focus group interview that social media is an important social arena for adolescents was confirmed also in the surveys of the adolescents. And the range of experiences adolescents have on social media are also very wide, and they cover both positive and negative things. And the surveys also give insights into the many different activities adolescents are involved in on social media, as well as the individual differences in relation to their experiences and what they choose to do on social media. And with regards to the differences between girls and boys, it seems that girls are much more involved and invested in their social media use compared to boys. And girls also report more positive and negative experiences on social media, probably due to a higher level of involvement. And with respect to online gaming, the boys report more social benefits from gaming than girls who are gamers. So for online gaming, their pattern seems opposite than with the more traditional social media platforms. And one of the topics we have been especially used some time on is self-presentation and upward comparison on social media. And self-presentation and upward comparison is common among adolescents, both on social media, but also in face-to-face interaction and outside of social media. And they put high value on how they are perceived, especially perhaps on social media and the feedback they get on social media. And so far in the project, we have documented that a high focus on self-presentation and upward comparison is associated with poorer mental health, lower quality of life, and higher levels of extroversion and lower emotional stability. In addition, a high focus is also associated with more alcohol and tobacco use. And we're also currently investigating how self-presentation and upward comparison on social media is related to perfectionism and symptoms of eating disorder. And so far, we have found some of the similar patterns that a high focus on self-presentation is associated with not only symptoms of eating disorder, but also unhealthy levels of perfectionism. And we have also had a focus on negative experiences on social media, as this is very commonly reported. So far, we have reported that there is a social gradient in negative experiences, meaning that those with lower socioeconomic status report more frequent and a wider range of different types of negative experiences. And this finding is robust even for adjusting for amount of social media use or adjusting for gender. So it seems to be a robust finding. And in a recent publication, we also find that both social exclusion and unwanted attention to negative experiences is associated with problematic drinking, and reporting a higher number of different negative experiences on social media is associated with both problematic drinking and frequent binge drinking among adolescents. And problematic media use is a commonly used term in the literature, and we have looked more closely at how we should understand the phenomenon or the term problematic social media use. And previously it has been operationalized according to duration or frequency of social media use, or by using general addiction criteria, or by rewording criteria from other phenomena like internet addiction. But since social media use is since social media is widely used among adolescents, this approach risks inflating prevalence numbers and classify unproblematic social media use as addictive or problematic. We have therefore explored how different types of activities, experiences, and motivations on social media are associated with problematic mental health outcomes and time spent on social media. So far, we have identified 3 factors: subjective overuse, social obligations, and source of concern. Although all of these 3 factors are associated with both negative mental health outcomes and more time spent on social media, there are important differences in how strong these associations are. And an important take-home message from this study is that problematic social media use seems to be multidimensional, and is not simply characterized by, for instance, amount of time you spend on social media. And finally, with regards to results from the survey, we have also looked into social support by looking at sharing something difficult, feelings or experience on social media, and we have found that this kind of sharing was also quite common, more common among girls, but also common among boys. And importantly, the clear majority of those who had shared something difficult reported perceived social support afterwards. And this perceived support was associated with a higher mental health well-being. So this is one example, at least, of how social media can be a positive social arena for adolescents. And based on the findings from data from the steps 1, 2, and 3, the intervention has been developed using a knowledge and consensus-based approach. The details of the intervention and thinking behind it will be published in a peer-reviewed scientific journal, as will the information about piloting and implementation. This work is ongoing right now, so I hopefully will get it published soon, and maybe next year. But in short, I just want to present the intervention, overall general idea of the intervention. It's a team-based teaching program with an interdisciplinary perspective, focusing on professional and social learning and development. And the program consists of 2 main sessions, one aiming to promote reflection and critical thinking around the use of social media, and another one aiming at getting the pupils to acquire and apply competence to exploit the positive potential of social media, while being able to cope with the challenges related to social media as a social arena. And to support this program, a dedicated webpage and with resources and team-based videos are available. And the intervention program is school-based, but it also targets parents, adolescents, and teachers, and everyone else who has direct contact with adolescents. And the plan now is to scientifically evaluate the intervention starting next year with a focus on potential effect. The main question is, does the intervention work, and potentially effective components of the intervention. I'll just end with what's to come. We will of course focus on the implementation and evaluation next year, but we also will still focus and continue to focus on specific topics related to different aspects of social media. And for instance, gaming as a social arena is very poorly understood, and we also need to understand, for instance, problematic gaming and also contextual and individual factors more thoroughly with relation to social media use. And we also hope to be able to adapt the entire project to younger adolescents to further increase our knowledge about the adolescents' use of social media and how it relates to their life and to mental health and well-being. So thank you for your attention, and here are some publications from the project so far.